Thank you everyone for joining us today on this HealthSherpa training with Benavest. Really excited to take you through and discuss some of the ins and outs of HealthSherpa, specifically as they apply to special enrollment periods and how you will process some of those on the platform. So I'm going to go ahead and share my screen here. Maybe. Okay. All right. All right, so couple notes here. Looks like Angie is recording the webinar, so we'll make sure that I send over a copy of my deck that we're going to go through. There's some additional links and resources that you can access through this slide deck. If you do have questions, we can do open Q&A at the end, or you can use the Q&A tool on your Zoom toolbar. That's just easier to keep track of which questions are getting answered and make sure we get to all of them. And I think not everybody's muted, so we'll skip that one. So today we'll talk a bit about who HealthSherpa is, what we're here to do for you and your business. We'll talk a bit about how to get your account set up correctly, quick refresher on that. Then we'll get into the SEPs and qualifying life events. We'll do a quick platform overview and then touch on some of those HealthSherpa resources that are available to you, and open it up for Q&A at the end, like Angie mentioned. All right. So to start off, who is HealthSherpa? HealthSherpa is really a marketplace for qualified health plans on the ACA. So we've been in business really since 2013. We've enrolled over 15 million lives in that time, 5 million plus of which have come in this current 2023 plan year. So if you've been in the business a while, or even if you're new to the business, you may be aware that right now the ACA is growing more than ever, and most of that growth is agent and broker driven. And that's where HealthSherpa comes in. Healthcare.gov is essentially a consumer website. It's made for consumers to go online, create an account, and enroll in health coverage. Unfortunately, most people can't figure out how to select the right health insurance coverage, and that's where you all come in. So we work with over 45,000 agents and brokers, 4,800 agencies. And we have coverage in all FFM states, and we're starting to roll out coverage in a couple state-based marketplaces this year. Kentucky will be available for double redirect enrollment starting at the end of this month, and then Georgia is going to move to a state-based marketplace either this OEP or the following OEP. And when they do that, they will have full EDE capability built in so that you can still manage your clients on HealthSherpa and enroll them into the Georgia state-based exchange right on HealthSherpa without needing to go to the state-based enrollment website. For all the other dark blue states, we don't currently have enrollment integrations. So you're welcome to quote in those states on HealthSherpa for clients, but when it comes to the enrollment, you'll have to go out to the actual state-based enrollment website, such as Penny or Covered California. And the 7.5 minute average EDE app time is really one of the key advantages to using HealthSherpa. We've been able to adapt the marketplace application so that we're asking really only necessary questions, and it takes agents much quicker to get through the EDE application on HealthSherpa than the average 25 minutes that it takes to do a healthcare.gov application. Okay, so what is Enhanced Direct Enrollment, or EDE? EDE is essentially a CMS improved enrollment pathway. So HealthSherpa works very closely with CMS, which is the Center for Medicare and Medicaid Services, and the overseer of healthcare.gov and all marketplace health insurance. The EDE technology allows you as agents to manage your book of business fully on HealthSherpa, so you can quote, enroll, manage your clients post-enrollment. You can see all of your clients in one central location. You can view policy statuses, see if they need to provide follow-up documents and what the status is of those follow-up document reviews by the marketplace. Everything right on your client dashboard that we'll get to in a bit here. And then how enhanced direct enrollment works. Well, double redirect, which is what we'll have in Kentucky this year. That really, it used to be that way for all states. And an agent had to open up their HealthSherpa. They would then get routed to healthcare.gov to complete the application. They would get routed back to HealthSherpa once the application would be complete, and then they would submit the application. So it was a lot of back and forth between websites, really a clunky process. Now they just complete the application right on HealthSherpa, easy peasy, and it's done. So a couple items to make sure you are ready to sell, even if you've been using HealthSherpa for years. Step one, when you create your HealthSherpa account, is you need to turn on EDE. So EDE, enabling EDE, this is essentially an identity proofing process to verify that you are the agent you say you are, associated with your NPN and your FFM username. And so when you click Enable EDE, it takes you through some personal questions about your credit history to verify your identity, similar to what the process you go through if you go get a loan for a car, for example. Once EDE is set up, it should be good for the life of your account unless you change your FFM username or your NPN. And step two is integrating your FFM account. So this is your